Well, Jackie, there's been a lot of debate about where this money is coming from. And let me tell you why this matters. The NHS already has a £14 billion cost-cutting programme. And if it has to fund some of this pay rise, the majority of this pay rise out of its own departmental budget, then it's going to be very challenging. My sources tell me that it's likely that about £2.5 billion will be expected to be found from within the budget, leaving about £1.5 billion to be negotiated still with Treasury ahead of the autumn statement. But there's a lot of anxiety about that. Of that £14 billion of cost-cutting, £5 billion has already been trimmed from areas like head office, from areas like technology. But remember, getting the NHS to be more efficient long-term is all about investing in areas like technology. And people I spoke to today were really concerned that these short-term cuts might actually end up stymieing long-term NHS efficiency. The questions about funding, Jackie, are really important. And I've been talking to one healthcare think tank, the King's Fund, about those funding issues and how the UK stacks up internationally.
It was the envy of the world.
Your National Health Service prescription.
They were being paid and patients were being treated. Fast forward to now. Morale has faded and staff are on strike. Even with yesterday's £4 billion pay offer for healthcare workers, there are still big questions over how that money will be funded and what it means for other services within the NHS.
So when I look at performance in the NHS, I have to say it's the worst I can remember in my career.
The chief analyst at healthcare think tank King's Fund is worried.
Fundamentally, I think you get what you pay for. We've said that we're not going to grow our healthcare spending in line with other countries. We're not going to grow healthcare spending in line with the past. What we then didn't do is say, and the consequence is inevitably poorer quality care.
Exclusive research for Channel 4 News by the King's Fund looked at how UK healthcare stacks up on the money we put in, our resources and what it means for patients. First, let's look at how much we spend per head. Germany spends over $7,000, France more than $6,000, while the UK trails behind with about $5,400. That means fewer resources. For example, the amount of doctors we have. In Germany, there are almost 5 doctors for every 1,000 people. In France, it's 3.17. In the UK, it's barely over 3. In fact, in Europe, we're the 6th worst behind Moldova. And then there's the number of hospital beds cut back over the last 30 years. In the UK, we have just 2.43 beds per 1,000 people, compared with France, where there's more than double that, and Germany, where there's almost 8 beds per 1,000.
We have fewer doctors per head, fewer nurses per head, fewer hospital beds per head, and less equipment, so things like MRI and CT scanners. So with that level of resources, it's perhaps not surprising that our system is struggling.
The latest figures on NHS cancer wait times shows not enough patients are receiving treatment following their urgent cancer referrals. The King's Fund looked at survival rates for colon cancer. For women with colon cancer, the percentage surviving after 5 years lagged behind other countries like Australia, Canada, Denmark and New Zealand. Many had hoped there'd be new money in the budget for the NHS, but calls for tax cuts and defence spending left pay awards in the cold, leaving the health minister responsible for forking out salary rises in the face of 40-year high inflation.
The government has indicated that whatever happens, they won't be taking cash away from what they call frontline services, which suggests there might be cuts to other things, backroom staff or management or other parts of the NHS bureaucracy. But I think one lesson from recent months and recent years is that one of the things that's holding the NHS back is those management structures, is those management processes, is the ability to run the system effectively. And there's a risk that if you cut back those things in order to prioritise pay for frontline staff, you do some damage to the overall functioning of the system and actually end up into more trouble down the line that ends up with further bailouts.
Since the 1950s, healthcare spending as a portion of national income has increasingly gone up, while defence coffers have been depleted. The war in Ukraine has challenged this and added to the fundamental problem that people are living much longer and increasingly need expensive medical care to do so. So what does this mean if we don't put up taxes?
If the government chooses, it's entitled to choose its fiscal strategy, and part of that strategy is, well, we're not going to fund the health service at the level we need to. What it then needs to do is say to the public, and here's what it means for you. And what it will mean
What does it mean?
Well, it'll mean targets to reduce the backlog of care not being met. It'll mean poorer health outcomes. It'll be hospitals that should have been built not being built. And basically people expecting a managed decline in the healthcare service. And that's the consequence of that decision.
Is that what's happening now, managed decline in the healthcare system in the UK?
I'd say we're at best holding steady. Holding steady.
Voters will have to figure out whether that's good enough.
Halia Ebrahimi there. Well, I'm joined now by Onay Kassab from the Unite Union, who's been taking part in the talks on NHS pay. Unlike other health unions, Unite has not recommended this week's deal to its members. Thanks very much for coming in. First, on exactly that point. Now, the biggest three unions are all backing this deal. Why aren't you?
Because of the nature of what's being proposed. For 2022, we are talking about an unconsolidated payment. That is going to do nothing for future recruitment in the NHS. By its very nature, it will only be paid to current staff. And the 2023 offer is a below inflation offer. So we've not been able to recommend it. It falls short.
The government's saying inflation is expected to go down quite dramatically.
Yeah, but my measure of inflation, my measure of the cost of living, my measure of the economic position is what our members are going through, about the money in their pockets, about the fact that we've got members working in hospitals and relying on food banks in hospitals. So that's the reality. They can talk about where inflation is, but that's the reality.
So in simple terms, the worry is that it's just not enough in terms of pay. Are you at all impacted by the idea, as Halia says, that it may be funded out of NHS existing budgets? Would that make a difference?
We're appalled to learn that today, because throughout this whole process, the government has been saying that this will be new money. It was one of the conditions for the unions entering into the current phase of talks. So we're appalled to hear that news. And I think when our members are now going to be voting on this, they're going to be taking that into account. First of all, we've been misled. And secondly, this is about saving the NHS.
Well, to be clear, the government have said that there will be no impact on patient care. There will be no impact on quality of care, patient services. You don't believe them?
No, I'm afraid we don't. We were told clearly that this will be new money. Now, what worries me is around January of this year, Stephen Barclay was talking about having to make productivity and efficiency savings. And we were saying at that point, how can you be expecting nurses and NHS workers to work even harder than they are? That's what's concerning us at the moment.
I mean, the problem for you is if the other big unions accept it, what happens? You're outnumbered, aren't you?
Well, we'll have to see if their membership do accept it. But our members have taken a principled position. They've had a look at the nature of the deal. We don't think it comes up to what we were putting forward. It doesn't deal with the crisis in the NHS. It's not going to deal with recruitment. But ultimately, it'll be up to our members to decide.
So what do you say to the other unions who say, let's back this deal, it's the best we'll get?
Well, that's their choice to make. Every union is able to make their own choice. And our members and our reps, I think, have made a principled choice based on our position, not looking at what other people are saying.
Did it make the difference that, as I understand it, the RCN went in first to negotiate with the government?
No, I don't think that made a huge amount of difference. At the end of it, we were in the same room all together. But what I want to put over is that it's our members. Our reps have made a decision to take it to our members, and our reps have made a decision not to recommend it. And ultimately, our members will make the final decision. And
so at this stage, what number would you go for?
Well, we want a fully consolidated pay increase. That's what we were looking for, and that's the part that worries me. 2022 is not a consolidated increase.
So you're expecting strikes to continue from your union at least?
Well, that's a possibility. If the unions reject the deal, then that's the natural next step, I think.
Onay Kassab, thanks very much for talking to us now. Thanks very much.